It's the largest person-to-person hepatitis A outbreak in Michigan history, and the Michigan Department of Health warns it's not over yet.
And unfortunately, we have had about 3% of cases who unfortunately have died because of the hepatitis A.
We've reported the hepatitis A alerts involving so many local restaurants.
But how do you stop this? Let's bring in our Dr. Frank McGeorge with a special report on the outbreak, which actually started in 2016.
Yeah, exactly, Devin and Kimberly. You know, since the outbreak began, there have been over 900 cases in Michigan, the majority in Macomb, Wayne, and Oakland County, as well as the city of Detroit. So I sat down with the heads of 3 health departments to see what's being done to stop that spread.
We have not been able to identify where the source of the outbreak is.
Dr. Jonay Caldoun is the director of the Detroit Health Department. Although no one knows exactly where the outbreak began, the numbers reported throughout southeast Michigan quickly outpaced the rest of the state, particularly in Macomb County.
As a health jurisdiction, we do have the highest number as a geographic county.
Dr. Kevin Lokar is the medical director of the Macomb County Health Department. He points out this does not mean Macomb County is doing worse.
Our proportion of cases has paralleled what's going on in the state.
And it has challenged every health department in the area.
What's interesting about this outbreak is that we've seen a high number of people who've been hospitalized.
Over in Oakland County, Dr. Russell Faust warns.
In those we had 5 deaths. Approximately 4%. So this is not an insignificant disease or infection.
In fact, to date, there have been 910 cases. 80% have required hospitalization, and 3.1% of patients have died. Although hepatitis A can affect any unvaccinated person, the groups that have been at the highest risk are especially difficult to treat.
Groups at risk have been those incarcerated, either in jails or state prison systems.
People that use drugs are at greater risk. Men who have sex with men. People who are struggling with transient housing, so either transient housing or homelessness.
And this has required some unique approaches to getting people vaccinated.
We've had actually over 1,000 vaccines given through the emergency departments here in the city of Detroit. We have implemented a grassroots strategy, again, trying to really reach people where they are. We've worked with the state to do outreach to bars.
We've worked with our county jail to administer vaccine to inmates.
Just as we do with healthcare workers, we aggressively go out and provide outreach clinics to food service workers.
Most notably, this is a statewide collective effort with meaningful cooperation.
There's a strong line of communication with the surrounding counties.
We were having conference calls every other week. Some of them were exclusively for Southeast Michigan.
This has really been an example of a great collaborative effort, not just from my state colleagues, but also with the CDC.
And although this hepatitis A epidemic has been a challenge to Michigan, it has had an unexpected benefit.
It's a great test of how we as public health come together to support the community.
We've built some relationships with a lot of community partners that I think will help us in the future.
All this effort has seen results. The number of new cases has been on the decline, and hopefully this ongoing outbreak will see an end. Nonetheless, even outside of an outbreak, hepatitis A is completely vaccine preventable, and it can cause severe illness. If you have not been vaccinated, this is well worth going to your local health department or talking to your doctor about.
Vaccine that almost always works, right?
Exactly. This is a really strong vaccine.